Namaskar, myself Dr. Vipul Gurjar. I am the professor and head of the surgery in SBKS Medical College, Vadodara. Today I am going to discuss about the pilonidal sinus surgical problem. See, the pilonidal sinus is it is because of the infection of hair root, and by the principle we need to remove all the foreign material like hair follicles and hair burrs from the infected site. Now, what are the problem? See, the recommended surgeries nowadays, first is the wide excisions. Now, we are not recommending because of the long-term morbidity and the recurrence is very high in the wide excision. Second thing, the peoples are preferring the different type of flap surgery. Flap surgery is in which the wide excision is done, and to cover that area we are doing the multiple different type of flap surgery. The success is very good in my practice, as well as I am very much happy, but it is somewhat a major surgery if it is a major, or some complicated surgery, but if becomes infected, then it gives a critical problem. The flap loss, necrosis, and after the flap infection, what happens? Then there will be a problem. But the chances are less in my practice. It's depend upon you. But nowadays trend is a laser. Everyone is doing the laser surgery, and everyone is saying that laser is giving a very good result. Okay, now uh, I want to see how we are doing this laser surgery. First tell me, and what is the principle of doing a laser surgery? In a laser surgery, what we are doing? We are doing isolated artificial opening and removal with the punch biopsy or the knife, whatever, and we are removing the infected site. Then we do the laser probe insertion and scraping of the cavity. In this way, tell me or think yourself how the laser is reaching ideally or really in a infected cavity or infected fistula. This is a purely blind procedure. Sometimes the track may be the superficial or 1 millimeter just below the skin. Sometimes it may be a 2 millimeter, it's sometimes 3 millimeter, sometimes 4 millimeter. How we are sure that laser is going the right way inside the cavity only? See, when I have started the laser, my success rate was only the 50 percentage, and nowadays also I am not that much fine with the laser surgery in a pilonidal sinus. Just for the being discussion, to do the discussion, please think yourself that laser has to go inside the cavity only or inside the fistula tract only. Then and then laser will give a result. But is there any way that our fiber is going a right way? Because the external opening is very small, 1 or 2 millimeter size, like that discharging sinus. Sometimes there will be a laser pilonidal cavity only, or sometimes there will be a pilonidal fistula. That means the external pus discharging opening, as well as there are a second opening in the gluteal cleft. This is a pilonidal fistula. we are missing that thing. So what is the trick? You have to do the possible infected region, put a small punch till a deeper tissue and inject methylene blue from the infected side, like in the external opening. This methylene blue will find out your artificial open a cavity. You can see the opening, a drop from that artificial cavity. You can put this artificial opening on either side of that opening, your pus discharging external opening. Then and then you can identify the real cavity or real fistulous, pilonidal fistulous tract. If you are able to do this thing, then the chances of recurrence is less. But still, in the pilonidal sinus by the laser surgery, what are the problem? Once we are doing this artificial opening in the midline, they require some observation, dressing, and it may heal approximately 1.5 months or 1 month. So the morbidity remains same, or the discomfort to the patient remains same, but it is a less invasive. Then we are doing a pilonidal sinus surgery with the laser. But in a future, we'll say the idealism of laser importance in the pilonidal sinus. In my practice, I have to do 50% in case I have to do second sitting or I have to open the cavity. This is because of I am missing a fistulous tract or the cavity, real cavity, and I am doing the blindly surgery, then it will no result. So think of that and try to identify the cavity, ideal pilonidal cavity or the pilonidal sinus tract. Then and then you can do. So this is the only trick. Thank you. Bye.